Have you ever felt completely fine, going about your day eating normally, sleeping normally, and never once wondered whether your kidneys might already be in trouble? Because here's the frightening truth that most people don't hear until it's far too late. Nearly 7 out of 10 people with chronic kidney disease don't even know they have it. No sharp pain, no dramatic warning, nothing that forces them to rush to the hospital. Life simply goes on. While deep inside the body, the kidneys may already be slowly losing their ability to filter the blood that keeps every organ alive. I've seen this happen more times than I can count. A patient walks into the clinic thinking they're just tired from work or that their blood pressure has been a little off lately. Then the lab results come back, and suddenly we're having a very different conversation, one about kidney function that has quietly dropped to half, sometimes even less. My name is Dr. Richard Hale, and after more than 2 decades working with patients facing kidney disease, I can tell you something that may surprise you. The most dangerous thing about kidney problems is not pain, it's silence. Kidneys are remarkably resilient organs. They can compensate for damage for years without causing obvious symptoms. But that same resilience can hide a problem until the disease has already progressed much further than anyone expected. And that's exactly why this conversation matters. Because once you understand how the kidneys work, why this disease stays hidden for so long, and what early warning signs most people miss, you can begin protecting your kidneys long before serious damage occurs. In the next few minutes, I'm going to walk you through something every adult should know: the quiet signals your kidneys may already be sending, the everyday habits that can slowly damage them without you realizing it, and the practical steps that can help protect your kidney function for years to come. And before we get into the warning signs most people overlook, there's something important you should first understand about these 2 small organs that sit quietly in your lower back. Because the truth is, the kidneys are doing far more for your survival than most people ever imagine. There is one type of medication that millions of people take every single day without thinking twice about it. It sits in kitchen cabinets, office drawers, and bedside tables across America. People use it for headaches, back pain, sore knees, or the aches that come with getting older. The problem is many of those same pills that bring quick relief can quietly place enormous stress on the kidneys. I'm talking about a group of drugs called NSAIDs, non-steroidal anti-inflammatory drugs, including common names like ibuprofen, naproxen, and several over-the-counter pain relievers you've probably taken before. Now, to be clear, these medications can be extremely helpful when used correctly and occasionally, but the danger begins when they become a routine habit. Many people start taking them several times a week, sometimes even daily, without realizing that the kidneys are the organs that must process and tolerate that chemical load. Over time, this repeated exposure can slowly reduce blood flow to the tiny filtering units inside the kidneys called nephrons. And when those delicate filters receive less blood, they begin to struggle. Let me share a situation that I've seen many times in real life. A patient, we'll call him Michael, a 67-year-old retired construction worker, came into my clinic complaining of fatigue and swelling in his ankles. At first, he assumed it was just age catching up with him. For years, he had taken over-the-counter painkillers to deal with chronic knee pain. Just a couple pills most days, he told me. Nothing unusual. Nothing he thought could possibly be dangerous. But when we ran his blood tests, the results told a very different story. His creatinine levels had nearly doubled, and his estimated kidney filtration rate had dropped significantly. When we reviewed his daily habits, the one factor that stood out immediately was the long-term use of NSAIDs. Not in extreme doses, not in an overdose situation, simply small, frequent doses taken consistently over years. And Michael's story is far from rare. In fact, several large clinical studies have shown that regular use of NSAIDs can increase the risk of kidney injury, especially in adults over the age of 60 people with high blood pressure or those living with diabetes. One report published in a nephrology journal estimated that a significant percentage of acute kidney injury cases seen in hospitals are linked to medications in this very category. The mechanism is surprisingly simple but powerful. NSAIDs interfere with certain chemical signals in the body that normally keep blood vessels to the kidneys open and well supplied. When those signals are blocked repeatedly, the blood flow to the kidneys narrows and the filtration system begins to suffer. The kidneys, as we discussed earlier, are remarkably resilient organs. They can compensate for damage for a long time without obvious symptoms. That's exactly why people rarely notice the problem developing. There's no sharp pain, no dramatic warning sign, nothing that forces immediate attention. Instead, the decline happens quietly sometimes over many years until lab tests finally reveal the change. What makes this even more concerning is how casually these medications are marketed and used. Because many NSAIDs are available over the counter, people naturally assume they are completely harmless. But from a medical perspective, available without a prescription does not mean safe for long-term daily use. In fact, most doctors recommend using them only for short periods unless a physician is actively monitoring kidney function and overall health. Now, this doesn't mean you should panic if you've taken a pain reliever in the past. Occasional use is usually not the issue. The real concern arises when the pills become part of a routine, something taken automatically whenever discomfort appears. In situations where long-term pain management is needed, physicians often explore alternatives or adjust medications to protect the kidneys while still managing pain effectively. If you've ever relied on painkillers regularly for joint pain, headaches, or back problems, it may be worth asking your doctor a simple question the next time you have a checkup. Should we check my kidney function? A basic blood test can provide valuable information and help ensure that your kidneys are still filtering blood the way they should. And if this sounds familiar to you, I'd be curious to know, have you ever taken pain relievers more frequently than you expected? Many people do without realizing it. Feel free to share your experience in the comments because hearing real stories often helps others recognize patterns in their own lives. But understanding the risks of painkillers is only the first step, because there is another category of medication that can place even greater stress on the kidneys when used incorrectly, and unlike pain relievers, these drugs are often prescribed during infections when people least expect a kidney-related side effect. And that brings us to the next group of medications doctors watch very carefully: certain powerful antibiotics that can quietly challenge kidney function in ways many patients never imagine. After understanding how common painkillers can quietly strain the kidneys, many people assume the biggest danger must come from medications they choose themselves. But here's the surprising truth. Sometimes the risk doesn't come from something you buy at the pharmacy counter. It can come from medications that are prescribed to help you recover from an infection. And the group of drugs doctors pay especially close attention to are certain powerful antibiotics. Antibiotics have saved countless lives. There is no question about that. Before the discovery of antibiotics, infections that are easily treated today could become life-threatening within days. But like many powerful medical tools, antibiotics must be used carefully, especially when it comes to kidney health. The kidneys play a central role in filtering many antibiotics from the bloodstream. That means when certain antibiotics circulate through the body, they pass directly through the delicate filtering units of the kidneys, sometimes placing stress on those microscopic structures. To understand why this matters, let me share a real scenario that reflects what doctors occasionally see in clinics and hospitals. A patient, we'll call her Linda, a 62-year-old grandmother, visited the hospital with a severe respiratory infection. Her doctor prescribed a strong antibiotic to control the infection quickly, which was the right medical decision at the time. The treatment worked, and within days her fever was gone and her breathing improved. Everything seemed to be moving in the right direction, but during a routine follow-up blood test, something unexpected appeared. Linda's creatinine level had risen, a signal that her kidneys were temporarily struggling. Fortunately, her medical team caught the change early. They adjusted the medication, increased hydration, and monitored her kidney function closely. Within a few weeks, her numbers returned to normal. The outcome was good, but the situation highlighted an important reality. Certain antibiotics can place stress on the kidneys, especially in older adults or in people who already have conditions like diabetes or high blood pressure. Medical research supports this observation. Studies published in nephrology and infectious disease journals have shown that some classes of antibiotics, particularly certain high-potency or intravenous antibiotics, can occasionally contribute to what doctors call acute kidney injury. This doesn't mean antibiotics are unsafe or should be avoided. In fact, they remain one of the most important tools in modern medicine. The key issue is appropriate use, correct dosing, and careful monitoring, especially for people whose kidneys may already be more vulnerable. One reason antibiotics can affect the kidneys is because of how they are processed in the body. Many antibiotics are eliminated through the kidneys. As the blood passes through the filtration system, these medications are concentrated in the kidney tissue before being excreted in urine. In some cases, especially when doses are high or hydration is low, This concentration can irritate the kidney's filtering structures. That's why physicians often adjust antibiotic doses for patients with reduced kidney function, not because the medicine is harmful by nature, but because the kidneys must handle the workload. Another factor that increases risk is self-medication. In some situations, people keep leftover antibiotics at home and begin taking them again when they feel sick without consulting a doctor. This may seem harmless, but it can create two problems at once. The infection may not be treated correctly, and the kidneys may be exposed to medication levels that were never properly adjusted for the person's health condition. In the United States and many other countries, healthcare guidelines strongly emphasize that antibiotics should only be taken under medical supervision precisely because dosing must match the patient's kidney function age and overall health. If you think about it, this actually highlights how remarkable the kidneys are. Day after day, they filter around 180 liters of blood, removing waste products, balancing electrolytes, and processing medications that pass through the body. Most of the time, they do this silently and efficiently. But when several stress factors combine dehydration, infection, multiple medications, or underlying disease, the kidneys can become overwhelmed. So what can people do to reduce the risk? The answer is not complicated, but it is important. First, always follow the exact instructions when taking antibiotics prescribed by a doctor. Second, stay well hydrated unless your physician advises otherwise. And third, if you are over 60 or have conditions like diabetes, high blood pressure, or previous kidney problems, it may be wise to ask your doctor whether your kidney function should be checked during or after certain treatments. These small steps can make a significant difference. In many cases where kidney stress occurs during antibiotic treatment, the changes are temporary and reversible, especially when they are detected early. That's why awareness matters so much. And if you've ever taken antibiotics for a serious infection, you might remember how quickly they can bring relief. But relief should always be balanced with awareness, because medications powerful enough to fight dangerous bacteria must also be handled with respect inside the body. But understanding the role of antibiotics is still only part of the picture, because there is another medical situation that can surprise many patients, a situation where kidney stress can occur even during routine diagnostic procedures in hospitals. And the next factor is something most people never expect: the contrast dye used during CT scans and certain heart imaging tests. And now we come to perhaps the most surprising risk of all, one that many people never suspect, because it is often labeled with a comforting word: natural. Across the United States and around the world, millions of people turn to herbal supplements, traditional remedies, and plant-based treatments, believing they are automatically safer than pharmaceutical drugs. But the truth is far more complicated. In some cases, these products can quietly place serious stress on the kidneys, sometimes without any warning signs at all. The reason many people trust herbal remedies is understandable. The idea of using plants, roots, or traditional formulas feels gentle and familiar. Advertisements often promise detox, natural healing, or kidney cleansing. Yet from a medical perspective, the word natural does not guarantee safety. The kidneys still have to filter every substance that enters the bloodstream, whether it comes from a pharmacy, a prescription bottle, or a capsule purchased online. Let me share a situation that illustrates this clearly. A patient I once encountered, we'll call her Angela, a 59-year-old woman, began taking an herbal supplement she discovered through an online advertisement. The product claimed to support energy metabolism and weight loss. The label listed a blend of plant extracts and traditional healing herbs, and because it was marketed as natural, she assumed it would be harmless. For several months, everything seemed fine. Angela felt slightly more energetic and continued taking the supplement daily, but during a routine medical checkup, her doctor noticed something unexpected. Her kidney function numbers had declined even though she had no history of kidney disease. After carefully reviewing her medications and lifestyle habits, the herbal supplement stood out as the only new factor. Further testing revealed that the product contained trace amounts of substances that can be harmful to the kidneys when consumed repeatedly over time. Once Angela stopped taking the supplement and her doctors monitored her closely, her kidney function gradually stabilized. She was fortunate the damage was caught early. Stories like this have appeared in medical literature more often than many people realize. Several studies published in nephrology journals have linked certain herbal compounds to kidney injury, particularly when products are poorly regulated or contaminated with heavy metals such as lead, mercury, or arsenic. In some cases, herbs themselves contain natural chemicals that can irritate or damage the kidney's filtration structures if taken in concentrated forms. Another challenge is that dietary supplements are often regulated differently than prescription medications. In many countries, including the United States, supplements do not always undergo the same rigorous safety testing required for pharmaceutical drugs before reaching the market. This means the purity, dosage, and interactions of these products can sometimes be unclear. Doctors have even identified a condition known as herbal nephropathy, where certain plant compounds cause gradual scarring of the kidney's filtering units. What makes this especially dangerous is that symptoms may not appear until significant damage has already occurred. Just like many kidney-related problems, the process can remain silent for years. This doesn't mean every herbal product is harmful. Some plant-based remedies are well-studied and can be safe when used correctly under professional guidance. The key difference lies in quality-controlled dosage and medical supervision. Products purchased from unverified online sources or promoted with exaggerated health claims should always raise caution. So what practical steps can people take? First, treat herbal supplements with the same respect you would give prescription medications. Always discuss them with a healthcare professional, especially if you have diabetes, high blood pressure, or any existing kidney concerns. Second, avoid products that promise dramatic results, such as rapid weight loss or complete detoxification. The human body already has a powerful detox system, and the kidneys are at the center of it. Most importantly, remember that protecting kidney health is rarely about a single miracle product or quick fix. It is about consistent awareness, understanding how medication, supplements, and everyday habits interact with the organs that quietly keep the bloodstream balanced every moment of the day. And if there is one message I hope stays with you after this discussion, it's this: your kidneys are working for you every second, filtering toxins, balancing fluids, and sustaining life even when you never feel them doing it. That's why the most powerful step anyone can take is simply staying informed, asking questions, and paying attention to the signals the body sends long before serious damage occurs. Because when people understand these hidden risks, from common painkillers to powerful antibiotics, to medical contrast dyes and even certain herbal remedies, they gain something incredibly valuable: the ability to protect their kidney health before problems silently progress. And that awareness, more than anything else, can make the difference between a lifetime of strong kidney function and discovering the problem far too late. Before we finish today, I want to leave you with something important to remember. Kidney health is not protected by one single pill, one miracle food, or one quick fix. It's protected by awareness and small decisions made every day. Being mindful about the medications you take, asking questions before starting new treatments, staying hydrated, and keeping track of your routine health tests can make a far greater difference than most people realize. The kidneys are incredibly resilient organs, but like any hardworking system in the body, they need care, patience, and respect to keep functioning well for decades. If today's discussion helped you understand something new about your health, I encourage you to save this video so you can return to it later or share it with someone in your family who might benefit from this information. Many kidney problems develop silently, and sometimes a single piece of knowledge shared at the right time can help someone recognize an early warning sign before serious damage occurs. And if you'd like to continue learning practical science-based tips about protecting your kidneys and improving long-term health, make sure to subscribe to the channel and turn on notifications. That way you won't miss the upcoming videos where we explore more topics that doctors discuss every day in clinics, but that many people never hear about. Most importantly, please remember this: your body has an incredible ability to heal and adapt when you support it with the right knowledge and habits. Even if you've made mistakes in the past or ignored certain health signals, it is never too late to start taking better care of your kidneys. Every positive step you take today, whether it's understanding your medications, improving your daily habits, or simply paying closer attention to your health, can help protect these vital organs for many years to come. Thank you for spending this time with me, and I truly hope this information helps you and the people you care about live healthier, stronger lives.